Samoa, Fiji, Tonga and Australia have already had confirmed cases of measles in the last month. Samoa calling a state of emergency after 61 children perished to the virus and a total of 4,500 confirmed cases. In PNG, the health department is now on high alert.
Papua New Guinea is on high alert, but we should not be in a panic mode. The key message that we want to give to our people from the Department of Health and our partner is that Papua New Guinea's routine immunization coverage has been low in the past, but efforts have been intensified to raise this coverage.
Health Secretary Pasco Kase appealing to parents to ensure that children born after June this year and children who have not received the full 3 dosage of vaccination to complete the full immunization.
A mass campaign against measles commenced in June 2019 that saw 1.17 million children from 6 months to 5 years of age vaccinated. This is more than the 95% coverage, higher than the WHO target. But there are pockets of population who may not have been vaccinated, or babies have been born after the supplementary immunization began in our country. We are therefore appealing to every parent and caregivers to ensure that their children are fully vaccinated.
This call comes after 2 cases of suspected measles tested negative. Provincial health surveillance teams have been put on high alerts to isolate any measles cases.
We, the national surveillance team, now support the province to investigate, including sample collection for testing. Our laboratory is here at the Port General Hospital, in the Central Public Hospital, which is a WHO accredited laboratory who can give us results in a reasonable time of 2 to 3 hours. So the lab is also ready to help us to say whether it's measles or not. We have so far tested 57 suspected cases. We did 2 yesterday, so our surveillance is ongoing. It's been there in the system before.
With the help of development partners WHO, UNICEF, Gavi, DFAT and others, the Department of Health says they are prepared to ensure that there is no outbreak of measles.
So I think we are at a very confident level at the moment just to allay some anxieties of the public, that we are at a heightened level of alert and we have systems in place not only for detecting it early, even in remote areas where the provincial information systems should be working, as we have done in the last 2 years, and also getting teams ready to respond on the treatment side. We have enough vaccines and we have enough treatment things.
As for travelers who wish to travel outside of the country, the National Department of Health has advised travelers to go to the Geruhu Clinic to get vaccinated.
Our appeal also goes out to travelers to the affected countries to ensure that they are fully vaccinated. We are also appealing to the clinicians and frontline health workers to ensure they are fully vaccinated.
And for those entering the country, the Department of Health are in discussion with NAC and Foreign Affairs to have nurses stations set up.
Next point of contacts that we already currently have with the airports, all the other critical agencies, including customs and Air Guinea. We just need to reactivate it. We have a plan that we normally activate when such things happen like this.
Whether or not a requirement for travelers to have certificates of being vaccinated before entering the country will be a discussion the Secretary looks to have with the Foreign Affairs.
I will get the technical team to provide some the communications going on with especially Foreign Affairs and the airport. But under the international health regulations, all countries have obligations to the world, but infections or outbreaks of diseases in one's own homeland, that traveling abroad should be restricted or precautionary measures must be undertaken.
But the message is clear. All infants born after June must be vaccinated. And if your children has missed any vaccination, to please ensure they all get the 3 dosages. Adelaide Xerox Kari, National, MTV News.
Latest news that came in.